there. Well, today's article is why you shouldn't push your pee out. And one of my closest friends texted me to say she's been doing this for years. So I'm Dr. Maureen O'Keefe, a pelvic health physical therapist at Purple Mountain Physical Therapy in Grand Rapids, Michigan. And I'm here to let you know that you should not be pushing your pee out. The situation of urinating should be that your bladder fills up quietly and you do not have urgency or frequency to pee. You're able to hold it without ever leaking. Then you get a gentle urge telling you that you need to pee. You're able to calmly walk to the bathroom, sit on the toilet, relax the whole situation. The bladder should be able to give you a little bit of a contraction because it's a muscle, and that will help expel everything. The urethra should be able to dilate and open up the gates, and your pelvic floor muscles should be able to melt and also open everything up. This should happen naturally without ever pushing, including at the end of peeing. You should be able to finish and get everything out without pushing. If you are pushing, you are essentially trying to force urine out through a closed door. Most often what we find as pelvic health physical therapists is that the pelvic floor muscles have high tone and stiffness, and they are unable to open up effectively to get that urine out. Sometimes there are issues with pelvic organ prolapse contributing to your inability to get all of your pee out, and there's strategies that you can use that do not include pushing in order to fully empty your bladder. Because we specialize in bladder, bowel, and intimacy related problems and prolapse, our physical therapists are uniquely qualified to help you stop this problem. When you're pushing your pee out all the time, you are increasing your intra-abdominal pressure, the downward pressure on that. And ladies, we do not need that to be happening because we are already, most of us have some level of pelvic organ prolapse. And over our lifetime, we don't want to be pushing everything down and straining the situation. Also, when you're pushing all the time, you are messing with the natural mechanics of peeing so that you're potentially straining your pelvic floor muscles or straining your urethra. We really want to train you to have the natural mechanics of peeing, and that's what we do in pelvic health physical therapy. If you came to us with a problem related to recurrent urinary tract infections, incomplete emptying, a constant urge to pee, urinary incontinence, urinary urgency and frequency, anything related to urinary or difficulty starting your urine flow because you have a neurogenic bladder or you had a bladder injury where it overfilled when you were after a surgery or anesthesia, we can help you out. Our physical therapists provide comprehensive hands-on treatments and exercise-based care if you need it in a one-on-one private setting here at Purple Mountain Physical Therapy in Grand Rapids, Michigan. If you qualify and we feel we can help you, we also offer remote consultations. And in those, patients have told us that it's really helpful to learn in this remote way from the expertise that we offer. So we're here to help you, and I invite you to call 616-516-4334 to speak with one of our knowledgeable staff members and see, you can ask questions and see if this might be helpful for your situation.